Dr. Evans, I want to start with you over at VHA. Give us an example of a specific program you'd like to highlight for the listening audience.
Sure, Luke. Well, I just wanted to come back briefly to what I mentioned in the first segment about telehealth. And I wanted to just provide one sort of adjustment to the data that we were doing about 2,000 video visits per day before the pandemic, which was quite a lot. We were one of the leaders in delivering telehealth to the home. And that increased to more than 30 to 35,000 per day now. And just to give you a sense to follow up on that, that's over a 1,200% increase in FY20 compared to FY 2019, so from before the pandemic to beyond. And what we're seeing in VHA is that desire for connections where there's a seamless intersection between both virtually delivered care, whether that be through secure email, whether it be through telehealth, or what the virtual capabilities, connected capabilities, are increasingly part of care right alongside face-to-face care. Both of them matter, and it's that sort of seamless combination of both that's really appealing to those who are receiving care from VA. On the topic of a specific project, to sort of take that the next step, right? Relationships are super important in healthcare, and telehealth technologies let us connect veterans and their caregivers with the staff members, VA staff who are there to care for them. But without the data to support clinical care delivery, we're missing something. And I think one of the things that really excites me, and this follows some of Ryan's comments in the first segment, is the volume of data interchange that's occurring across the health sector that continues to increase. And the real opportunity, as we increasingly are leveraging some of the standards that ONC is helping to promulgate across the industry, the potential is really significant. But I'll just highlight our Joint Health Information Exchange. This is a shared effort between the Department of Defense and the VA. And the DoD and the VA, as a shared joint health information exchange, are sharing data with more than 65% of private sector hospitals. And by the end of 2022, we're going to also connect to the Care Quality Network, which will increase our sharing to more than 90% of private sector hospitals. To give you a sense of what that means from a volume perspective, VA and DoD are delivering nearly 5 million documents to community partners. That means private sector health providers are able to see records of the care that we're delivering in the VA and DoD to support the care of the veteran or service member who's in front of them. And we're retrieving more than 40 million documents per month for VA and DoD providers to have access to that information that's occurring in the private sector healthcare system for the delivery of care to the patients sitting in front of us in the federal healthcare system. So super exciting to me. And the opportunity there, and I'm sure Ryan probably has some comments on this further, as we implement FHIR, as we continue to push this data interchange, we start to meaningfully insert that data into providers' workflows and into the hands of patients. I think there's a real tremendous opportunity in front of us over the next couple of years.